Hello everyone. Today, we're exploring the benefits and considerations of a medication called magnesium citrate, widely known under various brand names such as Citroma. As always, this discussion is designed for educational purposes. For any health-related questions or concerns, please consult with a healthcare professional. Description: Magnesium citrate, available under brand names like Citroma, is an oral solution that serves as an osmotic laxative. Its primary function is to increase water in the intestines, which can help induce defecation. It's commonly used for treating occasional constipation and in some cases, to clear the intestines before surgeries or intestinal procedures. Magnesium citrate works by attracting water into the intestines, increasing fluid, and stimulating bowel movements. This action helps to soften the stool and cleanse the bowel, making it easier for a bowel movement to occur. Warnings: While generally safe for most adults when used as directed, magnesium citrate should not be used by individuals with kidney disease or those on a magnesium-restricted diet without consulting a healthcare provider first. Overuse or prolonged use can lead to serious electrolyte imbalances and dehydration. Individuals with heart disease or those on diuretics should also use caution due to potential electrolyte disturbances. Before taking this medicine. Before using magnesium citrate, it's crucial to discuss any existing health conditions with your healthcare provider, especially if you have kidney disease, are on a magnesium-restricted diet, or have a history of heart problems. Pregnant or breastfeeding women should consult their doctor to weigh the potential benefits and risks. It's also important to mention any medications or supplements you're taking, as magnesium citrate can interact with certain drugs, especially those affecting electrolyte balance or fluid retention. Side effects: Common side effects of magnesium citrate include stomach upset, nausea, cramps, and diarrhea. However, if used as directed for short periods, it is generally well tolerated. Excessive use can lead to dehydration, electrolyte imbalances, low blood pressure, and more severe intestinal issues. If you experience symptoms of electrolyte imbalance, such as dizziness, weakness, or irregular heartbeat, seek medical attention immediately. Interactions: Magnesium citrate can interact with a variety of medications, including but not limited to diuretics, antibiotics, and medications used for osteoporosis. It can also affect the absorption of certain medications, so it's essential to discuss all current medications and supplements with your healthcare provider to avoid interactions. Dosage: The correct dosage of magnesium citrate can vary depending on the individual's age, medical condition, and the purpose of use. For adults dealing with constipation, the typical dose is 240 milliliters of the liquid solution, taken once, followed by a full glass of water. It's essential to follow your healthcare provider's instructions regarding dosage to ensure safety and effectiveness. For bowel preparation, your doctor will provide specific instructions on how to use the medication. Avoid: When taking magnesium citrate, it's important to stay well hydrated by drinking plenty of fluids. However, avoid excessive consumption of other laxatives or stool softeners unless directed by your healthcare provider. It's also advisable to be cautious with intake of magnesium-containing products to prevent overdose and adverse effects. FAQ: Many people ask about the frequency of use for magnesium citrate. It's designed for occasional use and not intended as a long-term solution for constipation. If you find yourself needing to use it regularly, consult your healthcare provider to discuss potential underlying issues and alternative treatments. Closing: This concludes our session on magnesium citrate. Remember, this information is for educational purposes and should not substitute professional medical advice. Always consult with a healthcare provider for any specific concerns or questions. Thank you for joining us.